Well, it's time now for a health report, and joining us now is Africa 54 health correspondent Linord Moudou with good news from Liberia. Linord.
Health officials in Liberia have released the last 2 known Ebola patients from the hospital. Liberian medical workers are grappling to explain how Ebola re-emerged in Liberia more than 2 months after it was declared free of the virus by the World Health Organization. The 2 patients released from the Painesville ETU are the father and younger brother of the presumed index case, a 15-year-old boy from a suburb of the capital Monrovia who died from the disease recently. Government officials say Ebola safety procedures remain in place.
I'm pleased to tell you that we are discharging 2 survivors of the Ebola virus from our unit. Unfortunately, they were free and passed, but we were able to manage the other 2, and they have successfully graduated.
It's a bad feeling was there for me, even though...
It is a bad feeling for me, even though I survived, but it is a bad feeling for me because I lost my son.
My first son I ever had.
My first son I ever had. He was my junior, 15 years old. He died unexpectedly to me, even though the nurses and the doctors tried the best, but it was time for him to go.
Even though the nurses...
And over 150 contacts are under quarantine. More than 30 of them are deemed high risk. Scientists in the United Kingdom say they have reached a milestone in the fight against malaria by creating a genetically modified mosquito that is infertile. The plan is to wipe out the insects that spread malaria to people via bites. 2 copies of the mutant gene make the malaria-carrying female insect completely barren. But 1 copy is enough for a mosquito mom or dad to pass it on to offspring. This should perpetually spread the infertility gene throughout the population so the species shrink or dies out. However, the Imperial College London team says more safety tests are needed, meaning it will be a decade before the mutant mosquitoes can be released into the wild. In other malaria news, biomedical engineers are developing a device that can quickly and accurately diagnose the disease in the field. This is not your average cell phone. The mobile device is a microscope said to be capable to diagnose malaria with the same level of accuracy as a high-tech lab. Texas A&M University biomedical engineers developed the new technology.
The way they diagnose malaria now is with a microscope, but it's a big benchtop microscope that's relatively complicated to use. Takes a trained technician, and you have to have the facilities for that scope in a centralized lab somewhere. So basically what we're taking is that gold standard and making it into a portable device.
The add-on device, known as a mobile optical polarization imaging device, MOPED, makes use of a smartphone's camera features to produce high-resolution images of objects 10 times smaller than the thickness of a human hair. The device images a blood sample using polarized light that can detect a malaria parasite by a product called hemozoin crystals. They appear as very bright dots in the image and are an accurate indicator of infection.
An application software that would take that image and be able to automatically count the red blood cells, count the number of parasites over different fields of view. And then by doing that, you can determine whether or not they have malaria or not.
The World Health Organization says in 2015, there have been around 214 million cases of malaria globally so far, with 90% of those deaths occurring in sub-Saharan Africa. The team says statistics such as those have inspired them to keep the device as affordable as possible to ensure it could be used where it's needed most. Smartphones are widely available in Africa, and the team say the cost of the add-on optics will be less than $50. The disposable blood sampling cartridges will be priced at less than $1. The team plans on field testing the cell phone microscope next summer in Rwanda. And that's our Africa Health Report for today. Vincent?
Well, Linord, thanks a lot. Be sure to watch Linord Moudou's Health Report every Tuesday and Thursday right here on Africa 54.